Good morning and welcome to Health Chat, where we talk about current issues in healthcare affecting individuals in Kenya and the world at large. I'm your host, Pendo Karima. Our topic today will be prostate cancer in Kenya, and we're going to handle causes of this sickness, age bracket of people prone to this sickness, and also prevention. Well, do you know that cancer is the leading cause of deaths worldwide, accounting to nearly a sixth of deaths in the last 2 years? And the number of men suffering from cancer is 20% higher than that of women, and the mortality rate is also higher in men with 40%. Prostate cancer also accounts for 17.3% of all men cancers and 10.2% of all other cancers in the country, and this is according to the Ministry of Health. According to researchers, some causes of this sickness include race, genetics, lifestyle choices, family history, and age bracket, whereby people in their 50s and above have higher chances of getting prostate cancer than those who are below. It has also noted that this sickness affects only men with African ancestry, but the reason behind this is not clear. And in our country, Kenya, very few men go to hospital to be tested for this sickness, and 88% of men, they usually go to hospital when the cancer is already at advanced stage. You should know that the screening process for this sickness, it is called prostate exam, which involves a PSA blood test that measures the level of prostate-specific antigen in your blood, and a digital rectal exam, whereby the healthcare practitioners insert a gloved finger in the rectum. Our reporters managed to ask a few members of the public some questions regarding prostate cancer in order to find out whether they know the seriousness of the matter.
Are you aware of prostate cancer?
Yes, I know about prostate cancer. It's the cancer that affects the prostate gland of the male reproductive organ.
Are you open to getting one done?
Yes, I would consider having a test for prostate cancer at least twice every year, and based on the recommendations of the doctor.
Yes, I'm aware about prostate cancer. I will actually not go to check if I have prostate cancer because I think, the fear of the unknown. You don't know if you have it or not. So I prefer not to unless I have issues. My name is Thomas Omondi. I'm age 27.
Yes, I know about prostate cancer. Of course, I wouldn't mind going for testing. Considering the lifestyles of these days, you have to get yourself checked.
We were able to talk to a nurse who is knowledgeable in the field, and he has worked with cancer patients, not excluding prostate cancer.
My name is Samuel Kai, a nurse by professional at Nairobi West Hospital, and I'm going to talk about prostate cancer. And why prostate cancer is actually the most common cancer among men in Kenya, in that all men are at risk of having prostate cancer at the age of around 40 to around 69 years old. In Kenya, age to rise rates is at 40.6% per 100,000, and prostate cancer accounts for 17.3% of all men cancers. You have to choose a healthy diet, low-fat diet, e.g. meat, nuts, oil, and dairy products such as milk and cheese, and you can also increase the amount of fruits and vegetables you eat each day, which are full of vitamins to reduce the rate of prostate cancer. Always maintain a healthy weight. Men who are obese with body mass index of 30 and above may have an increased risk of prostate cancer. And you can also exercise most of the days of the week, since it may reduce risk of disease of the cancer. And don't hesitate to talk to your doctor about the risk. Example, if you are on other treatment that can possibly increase the risk of having a prostate cancer, early testing of prostate cancer is equally advised. There is also the advice that can be given to men in general about their prostate cancer. You have to manage urinary incontinence, follow a prostate-friendly diet, build up your muscles by exercising on a regular basis. You can also solve your sexual problems by being sexual active and reducing stress, in that you can actually take a walk, read a book to distract your mind. Psychological care, talk to your relative concerning the mode of treatment, and basically you have the knowledge about the disease itself. You have to stop smoking and drinking alcohol, and that's all, so that you can prevent yourself from this deadly disease of that is prostate cancer.
There you have it. We should encourage men in our society to put their health first and get prostate exam done once every year in order for our health practitioners to mitigate the situation before it gets worse. And to the men, make sure that you live a healthier lifestyle, as our nation only prospers when both men and women are healthy. Take good care of yourself always. I'm your host Pendo Karima, and this is Health Chat.